Okay, thank you. No, I'm just so grateful to have people like Charlene in my life. She has been most recently my board chair at Capital Area United Way, but she is such a thoughtful servant herself. So thank you for that introduction, Charlene. Well, greetings. I am honored to have this opportunity to address the Rotary Club of Baton Rouge again on a topic that is near and dear to me, that being Alice. For many of you, you're already familiar with Alice, but for those of you who are not, this is your lucky day. You're going to learn about a large part of our community that oftentimes goes unnoticed and unheard. So we're going to unpack a little of what that looks like both in Louisiana and in our region. But before I do that, I want to just talk about the people that make it possible for an organization like Capital Area United Way to be around after 100 years. This year we celebrate our centennial just this past November. And you know, to have any organization survive that long requires a lot of support from the community, a lot of support from organizations and dedicated volunteers. So I'm going to call up some folks. I'm going to ask you to stand if you have served as a board member currently or in the past. If you could please stand. All right, remain standing, because this is, those of you who stood, remain standing. Next, I'm going to call on our staff, those folks that currently serve and anybody who has worked at Capital Area United Way over the past 100 years. All right, and then next, I want our corporate partners to stand, those that have that run campaigns, that have volunteered and do work with us. Would you please stand? Anyone representing those corporate partners? Yeah. All right. And then those donors, those lovely donors that support our work, whether it's through a foundation, individually, or you know, any other form or fashion with those organizations. Steve, I see David, yeah, with the Wilson. Yes, yes. And then our volunteers, those folks who volunteer with us, please stand. Yeah. And then, last but certainly not least, the folks that, how can I say it, that do the work, that receive grants from us, that are funded by United Way dollars and resources. All right, ladies and gentlemen, these are the people that make it possible for us to do the work we do. Thank you all. All right. Well, I mentioned about United Way, we're celebrating 100 years. We serve 10 parishes now. You know, we have a mission to improve lives by mobilizing community resources so everyone in our region can thrive. We have focus areas in the areas of community resilience, youth opportunity, financial security, and healthy living. And interesting fact, over the last 3 years, we counted the number of organizations that we've funded, over 89 organizations that we've funded over the last 3 years, and over $10 million invested in this community over the last 3 years. So the work has definitely gone on here at Capital Area United Way, but I will be the first to tell you, it's never enough. It's never enough. There's always need for more. And what you'll hear in this presentation is why that is needed. So let me get my clicker here. and we'll move through who is Alice. And I covered a little bit about this, who we are, our mission, and the focus areas. So, this Alice, a lot of folks have struggled with how to describe Alice. And I like this name tag approach. First of all, imagine a person who comes up to you and says, you know, I'm a hard worker. I live paycheck to paycheck. I struggle to make ends meet. I make tough choices daily. I'm Alice. So Alice is the neighbor that we live next to, the person we go to church with, the person that checks us out at the grocery store, the person that serves us at the restaurant. There are so many people in our community that make up Alice. But what I'm aiming to do today is to give you a little more detail about what makes Alice unique and why we need to be more aware of who Alice is. So Alice is an acronym that stands for Asset Limited, Income Constrained, but Employed. And it's an acronym that was developed through some research that was done by Rutgers University, probably over 15 years now. But our state of Louisiana was among the first states, the top 10 states that adopted Alice early on. So we've been doing this for over 10 years, this research. We've been participating in it. We also have had a strong partnership with Entergy. Entergy adopted this as a statewide initiative of theirs over 10 years ago, and they have supported the production of the Alice Report for the state of Louisiana. So we're very pleased with that partnership. The Alice Report, and I actually brought the book for Louisiana here. This is what it looks like. If you would like your own copy of this report, see me after. And we also have it available electronically. You can access it through our link. It's United for Alice, and then LAUnitedWay.org. So you can reach it via electronic medium. So when we talk about Alice, the threshold for determining what the cost of living is for a particular community is driven by categories of housing, childcare, food, transportation, healthcare, technology, taxes, and miscellaneous. And I know that's hard to see, but the real takeaway here is the monthly income that's needed to, or the monthly expense, for example, for these different categories. For example, for a single adult, the monthly total is $2,433. For a single adult, that the amount is $23,000. All right.
Break them out.
My official glasses here to help me see this fine print here. So $33,408 is what's needed for a single adult. And the first number I gave was for a single adult between the ages of 18 and 64. But when you look at the cost for 2 adults, 1 infant, and 1 preschooler, it goes up to $81,000. So it's above $81,000. That's what it costs for a family of 4 with those, 1 child, 1 infant, and 1 preschooler. That's what it costs for them to cover the basic living expenses. Now, I don't know about you, but when I looked at this number, it was pretty daunting. And these are some of these numbers I think are a bit understated because they have rent or housing cost at $1,003, just over $1,000. I don't know where you're going to find a house that can accommodate folks in that category. So those are real numbers. Those are the kinds of numbers that folks that are living below that ALICE threshold have to deal with. Now, did you know that half of the households in Louisiana struggle to make ends meet? These two numbers combined, ALICE and poverty, account for 50% of our population statewide. The other fact is that 21%, only 21% of working age people had a full-time salaried job, and 44% of workers in Louisiana's 20 most common jobs couldn't make ends meet. So I looked at the latest stats on unemployment. We're hovering just above 4% in unemployment, which is still considered low. But when you think of that, you would think that the economy and the well-being of individuals would be much better, that we wouldn't have numbers like this. But we have a challenge in our state, and that is there's an abundance of jobs, but not enough jobs that are paying folks above a living wage. And that is a challenge. The other challenge is that as one of the poor states, our ALICE numbers, we lead the country in the number or percentage of individuals that are below the ALICE threshold. That's not something that we, well, it is what it is. It's not something to be proud of, but that's where we are. We have a lot of folks that are working, but a lot of folks that still need to have opportunities that can pay them at a level that would allow them to cover their basic needs. So, let's look further. The demographics of hardship. When you unpack what ALICE looks like in that 50% statewide, a couple of things jump out at you. That number one, it's primarily composed of Black households, and that the other group is those that are age 25 and below, and then the other group is single female-headed households. That's the profile. And then when you look further at racial ethnic group with highest percentage living below the ALICE threshold, 66% of Black families in Louisiana. That's 44% ALICE, 22% in poverty. Now, this graph shows a trend from 2010 to 2023. And it shows that ALICE as a total, the blue line, has increased from 46% to over 50%. And poverty has increased as well, especially in recent years. Now, what does it look like across the U.S.? Well, in every state, 30% of all households cannot afford basics. And as I stated earlier, Louisiana ranks at the top of that list of financial hardship in USA at 50%. Now, I mentioned earlier, we serve a 10-parish area, and let's see what that looks like for our region. 51% of individuals in our 10-parish region are ALICE and below poverty level. But that ranges from a low of 37%, which is West Baton Rouge Parish, and St. Helena at 62%. East Baton Rouge Parish is right at 51%, so slightly over the state. Needless to say, that presents some unique challenges for us. We have a region that has some areas that are very well off and that have done well, but we also have those areas like St. Helena Parish, like Donaldsonville as a subset of the Ascension Parish. Their ALICE numbers are above 70%. So we have tried to use this data to focus on the areas that require additional attention, additional support. And, but like I said earlier, it's never enough. There's always a need for more. So, looking further at our 10 parish area, this is what it's looked like over the last 3 years. 49%, 50%, 51%. Steady increase over those 3 years. And I would venture to say that it has continued since the last report. So, that's ALICE. And when you think about the challenges that we have as a community with numbers that high, you have to ask, so what can we do about it? Well, we put together some information that through some of the research and some of the feedback we've gotten from folks that work in this space. And by the way, we're going to an ALICE Summit in January that is hosted by the folks that produced the ALICE report. We've been invited to attend that conference, and we're actually going to speak at that conference. We are honored to have a project that won the favor of the folks that make those selections. And our topic is going to be on a project that we're doing with ExxonMobil that looks at providing child care scholarships to preschool kids that are needing to have access to quality child care support. And this is a wonderful program that we piloted several months ago, and Exxon was so pleased with the initial results. They've made a significant investment in helping to provide more slots and providing that support not just for 1 year, but for the entire duration that that person is going through. So from 0 to 5, that's a major investment. And the way those individuals are selected, they're selected based on their the fact that they're working or they're pursuing some type of education that's going to help lift them up from the ALICE position that they're in. So those are the kind of creative solutions that are needed to help address some of these issues. But employer support for ALICE, what does that look like? Well, first of all, offer flexible scheduling to accommodate second jobs, child care needs, etc. I know many folks, many organizations have employees that may leave their job to go to a second job. I remember when I was at the hospital, we had folks that clean the rooms, cook, that would work a 7 to 3 shift and then leave and go work at a casino or go work at a hotel. That's what folks do, and that's what ALICE or having a low-wage job forces folks to do. They have to look for those opportunities. But what I've learned is that when they look for the opportunities that take them out of the home, who's minding the kids? Where are they? How are they being served? So those are the kinds of things that we have to unpack and we have to be mindful of. Provide quality, affordable health insurance and other benefits. I just went through this with our benefits program. We got our notices about healthcare cost for our staff. And prior to that, we had a employee share in the premium cost, the cost of the premium for employee coverage. And we looked around and said, we have several employees that don't have kids, really could use additional support there. So we made the decision to cover 100% of the premium for our employees, for their coverage. Now, they still have to pay for family coverage, but that was something we felt we needed to do. Another one is ensure all employees earn a living wage. Now, imagine 4 years ago, we had an employee that saw us talking about Alice and the needs of Alice and how important it was for companies to recognize this. So he called me to task. He said, I'm looking at these numbers and we talk about Alice and the importance of supporting employees, workers in the workforce, but I'm earning below Alice. So I went back and we restructured the salary levels, and now we have folks above that Alice threshold for individual. And guess what? We survived it. It's a minor adjustment that you can make, but it sends a strong message that you believe in your employees and you are willing to support them. So, food for thought. Offer training, tuition reimbursement, and opportunities for career advancement. That's one that's pretty self-explanatory. The pathway to getting folks to a level of self-sufficiency is oftentimes involves additional training, additional advancement. Sometimes it involves them leaving your organization. I've had that happen too. As painful as that is, it's part of what we do. It's important for folks to grow and develop to where they can leave the nest and pursue other opportunities. So we try and create those opportunities within our organization, but sometimes they're able to do it outside of the organization. But that is important for growth and development. And then this one is near and dear to me. Partner with organizations to help address employees' basic needs. Now that one is finding those organizations that are doing things to help these employees and folks who are in need of this kind of training. I'm reminded of Hope Ministries, their Way to Work program. Excellent program. It's a program that we've funded, and it helps employers understand the challenges involved with working with those individuals, and it also helps those employees. It helps them polish their skills, better understand the things that they need to do to make themselves more marketable. But there are other programs out there that are doing that work, and we look for those programs and we try to support those programs as well. But I encourage you to seek out and find organizations that are doing the work. And if you want to learn more about that, I'm more than happy to talk with you and share. Educate managers and supervisors about the challenges Alice individuals face. If you live in a bubble, you don't see the need. You don't see how challenging it is for some folks to just show up. Car repairs, things like that can really derail a person's ability to show up at work and be punctual and those things. And it's happening every day. Now, I'm going to give you a resource that can also help, and that is 211. If you don't remember anything else from what I've shared today, I want you to remember these three numbers, 211. Now, why is that important? Whenever someone has a situation where they need assistance, they need help, they need to find where that nearest food pantry is, or where they can go to get rental assistance or utility assistance, 211 is that resource. It's a 24-hour day, 7-day a week call line that is answered by a person, and that person has at their disposal a database of resources that they can listen to the need and make a referral to. Now, is that the end of it? No, because not every referral is able to meet that need, but those folks are there to help guide them through that process. And if you've ever been in a situation where you don't know where to turn, that can be pretty daunting. So that's why I believe that more people being aware of that number and the resource that's available. And by the way, that resource, that database is something that is compiled by my team for our region. And those folks who compile that information seek out information to make sure that it's accurate and up to date. So if we learn of a program or an organization that no longer offers a service, we'll make that adjustment so that the information of those calls is accurate and up to date. All right. I'm going to open the floor for questions because I think that is important as well. Ms. Pam.
We are a state with a low minimum wage. Most of my peers say, don't worry about it.
Because the people making that minimum wage are just teenagers. Yeah.
Not the
I
case.
mean, so how do you, what is it, $7.20
7
an
something.
hour?
Yeah.
I mean, that's a far piece from how much you need. Working in the homeless shelter that we have, I'm always, people are homeless because they're poor. And a lot of them have Social Security or disability, but they can't find a place to live even with that amount of money. So our whole paradigm mentally needs to adjust, I think, around why do we have such a high poverty rate?
Well, Pam, well, first of all, thank you for all you do. You know, Pam, if you don't know, has written many grants that have supported nonprofits in this community, and she is one of those folks that has been fighting this battle along with us. So thank you. You know, we've advocated for an increase in minimum wage. I mean, I can't say it any more plainly than that. That's one area, but that's not the only answer. That's not the only solution. We need to look at doing other things as well. The cost of living definitely has increased from when that was set. Next question.
Hi, I didn't have a question, George. I wanted to piggyback off something that was just said. Volunteering down at St. Vincent de Paul, I ran across a young lady and we had conversations, and she told me it started first with her car. Like, her car didn't work, and then she wasn't able to get to her employer because the buses couldn't get her where she needed to go, and she didn't have family resources. So then she lost her job.
Oh, yeah?
And then it's just a snowball effect of how she got there at the shelter with her children. And I reached out to try to help her with employment after our volunteering there. And that's all, she just needed a hand up. She just needed a job, and she needed some resources to get back and forth to work. A lot of people you see are homeless or are not there because they wanted to be.
Yeah.
It just took one mishap in their lives to put them there. So it gave me a better understanding on how people get there.
Yeah. And Karen, you brought to light something. It's not that they want to be there. They don't want to be there. It's just that their lives are so fragile that one car repair that she couldn't get fixed started that downward spiral. So a couple of things I want to make sure you are aware of too. One of the things that makes a big difference is being able to have your taxes done free of charge. We have a program called Volunteer Income Tax Assistance, VITA, and we have over 100 volunteers who help provide free professional tax preparation for the Alice population. We do over 6,000 returns a year, and it is a wonderful program, and it's one of those things that makes it a little less of a burden for those folks to have their taxes done. The other thing it does is they're trained, these trainers are trained in making sure that, excuse me here. All right. I learned how to start it, but I don't know how to stop it. So anyway, those tax preparers are trained at helping them qualify or making sure they qualify for the earned income tax credit. That can make a difference between a $500 return and a $2,500 return. So it's very important. If you don't do taxes, if you have an interest in learning how to do taxes, please volunteer. Please consider volunteering. That's some of the most gratifying volunteer work that you can do, is to help folks who have a need for taxes.
One last question.
One last question.
George, thank you for the work you guys do. But if you would, can you explain how United Way works with partner organizations like St. Vincent de Paul, like Hope Ministries, to go about doing the work that you do?
Sure. I'll give you a couple of examples, if that's all right. First of all, we are a funder. We fundraise, but we also fund organizations. And I gave the figure of 89 organizations over the last 3 years that we've funded. So we have grant cycles that we do on a regular basis, 3-year funding, just by show of hands. I know, Patrick, you guys are a 3-year funded program. Anybody else out there? Yeah, all right. 3-year funding programs. Imagine that, a sustained amount of income coming in over 3 years. So we do that. The other thing we do is we have other rounds of funding, like basic needs funds that are annual in nature. We have other funding that may be one time. We have disaster funding. You know, we started up in with the government shutdown, with a lot of the challenges that we were experiencing and seeing in the community. I convened the food insecurity providers, and we talked about what's going on. This was about 3 weeks ago, 3 or 4 weeks ago. And the common theme was demand for food has increased and the available supply of food has decreased. So we took that information and we went back to our offices and said, we have to do something. So we started a community relief fund, and the funds that we receive from that will go towards food insecurity. Now, yesterday was Giving Day. We put out there a request to receive funds, and we're going to match every dollar that we received yesterday from that. And I'm going to extend that. Amy, we're going to extend that match up to $50,000. We're going to extend that match. So we want to do that to make sure that we're able to support the needs that those organizations are experiencing right now. But that's how we work with them. That's some of the things we do. We convene, we have grant processes, we're there to support them in other ways through volunteering or through helping connect them to other resources. It's all about strengthening the ecosystem of support that we have in this community. And we have a very generous community, but the needs have really grown over the last few months, and we just need to be aware of that. All right. Thank you all.